let's talk about the BeautiFill. And one of the reasons I'm so excited for this machine is it is a sign that newer and less invasive technologies are coming out and in the pipelines. So what is the BeautiFill? BeautiFill is a non-OR liposuction / fat transfer device. Now let me rephrase that: liposuction plus fat transfer. So we are not your plastic surgeons. I cannot give you a mommy makeover. We are also not meant to be doing liposuction 360 and full body liposuction. So where does this device fall in? This device is wonderful for those small areas, raw fat, a little bit of love handles, if you wanted to do kind of your lower abdomen because you've lost all that baby weight but now still have that little pooch. So those small pockets of fat that are not subdermal, because you know the TrueSculpt ID and the TrueSculpt Flex addresses the fat that's right underneath the surface of the skin. This is actually that deeper fat that kind of gives you that nice, you know, little love handle that you can grab onto. We want you to not be able to have that. And so to smooth it out, it's an in-office procedure. You're awake the whole time. You have some mild sedation. We make little tiny incisions with an 11 blade, of course, with a local anesthetic. And we kind of fill up the pockets that we are addressing with lidocaine and saline, and give it about that 15-20 minutes, let it numb up so that you don't feel anything. The other wonderful part about the BeautiFill, and which is why the fat cell integrity is preserved much better with this, is we are taking a laser beam and we are going in afterwards and essentially loosening up the fat cells from the surrounding skin and skin tissue. So because you are not aggressively pulling those fat cells out, the viability of the fat cells, because we want to take that fat, micronize it, and shape it and put it into areas, face, butt, breasts, any of those areas that you want to add a little more volume, because we lose volume in those areas as we age. We can go in and contour those areas out for you. But because you're using a laser beam to detach those fat cells, the viability is much better. So in about 3 to 4 months after your procedure, the goal is to hold on to a minimum of 70% to 80% of your fat cells, whereas in traditional liposuction you're losing more, about 30 to 40% fat cells in traditional liposuction because it's taken out so aggressively. To be quite honest, one of the things I love about this device is that you are an active participant in the procedure itself. So because you are not under anesthesia, because you're awake, we are able to stand you up, we are able to get different angles, we're able to feel it in different positions to make sure we don't have any dimpling left, and we make sure we don't have any striation, so we can really give you a nice, smooth, sculpted look in whatever areas that we are working in. The other thing is you have minimal downtime. One of our patients that we did last week, she actually ended up going to Disney about 10 days after her procedure. The biggest thing is we want you to wear compression, minimum of 6 weeks, but ideally I would love for all of my patients to wear it for 3 to 6 months. You will obviously, because we filled up that area with lidocaine and saline, you'll have a little bit of draining for about 2 to 3 days, and you'll have swelling and a little bit of pain, which we do give you medications to make you comfortable. You don't need sutures because the incisions are so small, and we follow up with you a week after your procedure, 3 weeks after, a month after, and so on to make sure that we give you the best, most sculpted results that we possibly can.